Dr. Michael Gottfried from the Chiropractic Society of Rhode Island with our podcast, Get a Spine. And with me today, I'm very excited to hear from our guest, Lisa Raiola of Hope in Maine. And she has a very interesting background. She's an educator, and she has a background in nutrition. She has a background in social justice. And she, well, we're going to hear from her, actually. I don't need to say it because I just read it off the bio, but I want to hear from her. So, Lisa, tell us a little bit about your background and how you came to.
First of all, Mike, thank you for the opportunity this morning. I love what you're doing. I love the idea of Get a Spine. There couldn't be a better time to ask people to be doing that because my background is in public health. And so in public health, we understand that, you know, we're interdependent, you know, as a community, and what I do, you know, and the decisions that I make have a consequence for you. So if I don't wear a mask, I'm actually putting your health at risk, right? So this is all about taking care of each other. My background is in public health, medical ethics, nonprofit, education, social justice, all of the things that you said. I spent about 15 years at Harvard Community Health Plan, Harvard Pilgrim. I was then teaching at the medical school at Brown in the early 2000s, and about 10 years later, I started Hope in Maine during the last recession, actually, as something that really combined all of my interests in community health, food systems, and the idea that, you know, we can build a more sustainable, equitable food system by really empowering both the entrepreneur to start food companies, that's what we do here, and the eater to have access to healthier, more nutritious and affordable food. So my background sort of combines all of those things.
So it's an amazing background, and you look a lot younger than all that background would lead us to believe here with all your experience. So tell me about what a food incubator type organization is about, how it operates, and tell me some of your successes.
So what you can see maybe behind me, you can see these posters, right? So I'm in our sort of community space right now, and upstairs from me are 3 commercial kitchens, and this is what we did is we repurposed a school that was built in 1915 and been abandoned for about a decade here in Warren. So in 2010, I saw this abandoned school, and, you know, my interest was in food systems and entrepreneurship. And so the idea was to take this school and build commercial kitchens where people can actually start food businesses. They can, in a very affordable way, start their businesses here, because you have to be in a code compliant facility in order to have your food processing license in Rhode Island. You can't make a food product out of your garage and sell it, right? Or out of your home kitchen. And what people do here is they rent the kitchens by the hour, and they make their products here, everything from biscotti to salsa to tea. There, you know, we have, since we started, launched over 250 food companies. And what we do is we help them to launch their business, make their product here, but also we teach them how to run a business, because having a product doesn't mean you have a business. So what we're doing is we're helping people of all means and backgrounds to launch thriving food businesses. To date, we've had about 50 very successful graduates. One that you can see in the background is a Backyard Food Company that's now in 3,000 stores around the country. And They've done very well. There's others like PV Donuts that you may have heard of in Providence. That's also has a lot of local, has a big local following. Just look at the line outside their door at any time of the day. So, we're about both economic development for our food system and about economic empowerment for entrepreneurs. That's what we do.
That's awesome, and I do have personal experience in that. My niece started a habanero sauce with her partner in Brooklyn, New York, and so I watched, how that goes. And like you said, there's lots of requirements and all. And on top of that, my daughter went to BU for a follow-up degree in culinary arts, and her husband is a chef. So there's a lot of food-based happenings in my family.
Mm-hmm. And send them over here.
What's that?
Send them over here.
Well, I'm excited to hear about it because, we may be able to link up on a number of different levels with this very different time that we're facing now, the COVID happening. How has that influenced what it is that you're doing?
So what happened in March was, as the pandemic descended, you can imagine that, a lot of food businesses were unsure how they were going to go forward. So we had businesses that, were counting on events that didn't happen. We're counting on markets that didn't happen. We're counting on food service channels that cratered. And we really had to pivot very quickly on the behalf of the members. And interestingly, we had maybe, half a dozen companies that have some type of food truck, food trailer, catering business, prepared meals. And one of the things that we did in March is we activated a status that we have as a food safe facility. We're financed by the USDA, so we have all of our licenses as a food safe facility here, and we activated our status as a distribution point for the Department of Education, so that when the meal service closed down in schools, we were able to distribute meals to this East Bay region of Rhode Island to food insecure families, right? And so the families were coming to pick up whatever the district was making cold grab and go, food, which isn't great. I mean, they're pretty limited to what they're able to do. And we looked at that and said, as the demand started to surge, we thought, maybe we can raise some money so that we would be able to supplement that food with prepared meals that are reheatable and, met certain nutrition requirements that we set out. And so we decided to raise the money, give $7.50 per meal to a member company, these young chefs that are here that are really creative. And we said, listen, with this money, pay your staff, pay yourself, and buy the food and make, 300 meals a week. And we started to distribute those meals, those prepared meals, and they were like amazing. So we had maybe 3 chefs per week making 300 meals. So it was maybe 1,200 meals that we were distributing each week. And they were so creative, and the families were loving them. And I looked at this like 3 weeks in, and I said, these meals are so great, we could sell them and to people who could afford them. So then we decided to create what's called a community meal share program, where you buy a meal for yourself for $16 and you're giving a meal to someone else who couldn't afford it. So it's like Tom's Shoes. And that has gone really well. We have over 100 people every week who are buying meals at $16. And what I love is it's the exact same food that we're giving to families, to seniors now that are, shut in, quarantined, and, they're low income and, at risk. And so the prepared meal model is a great one for them. Women who are in transitional housing with their children who have been victims of domestic violence, which has been on the rise during this pandemic, sadly. They can't food shop. They have no ability to prepare food, but they could reheat something in a microwave. So we have these populations of people that have really needed these services in this time. And the community has stepped up in a way that I think is what I talked about before, realizing that in this moment, we are interdependent. And if I have an extra $8, I can choose to eat a meal that's going to feed somebody else. And we've been so proud of the way that people have understood this dynamic and stepped up. As of today, we've raised over $200,000 for this program.
Wow. Wow. And you actually, that's great. That's super. You actually answered my next question about donations, because I did take a look at, your website and all. And so I'm in for 160. You have a 160 kind of donation, right?
Yes, thank you.
Yeah. So I'm in for 160, and thrilled to be in for 160. And I'm amazed at all that you do. And is there a further vision for where you see things going, or you're making it up as you go along with this new crisis? What do you see? Where do you see yourself going with this?
So one of the things that's really exciting about this, Mike, that the program's called Nourish Our Neighbors. And what it's done, it's created business continuity for the small businesses that are here, right? Because they're making this food. It's created opportunity for local farmers and purveyors because they're buying as much of it locally as they can. It is feeding our food insecure community, and it's providing great food for our folks who can afford to buy these meals. So where I see it going is this larger picture of sustainability and equity in our food system, right? Like, you've probably seen long lines outside of food pantries around the country, right? Food banks around the country, because our food system, the way we've dealt with hunger is through charity. And in the long run, that isn't sustainable. We can't decide that we're going to, make nutritious food accessible and affordable through the charity system, as more people need this assistance. And as a clinician, that nutritious food is so important to maintaining your immune system and defending yourself against something like coronavirus. So how do we do that? I think people have become very aware of issues with our food system, food access. Even if you could afford to buy food, you've had some crazy food access problem where something you buy isn't available, or you have to make some surgical strike in the supermarket now. So where I see this going is this sort of virtuous circle where I think people in the long run will be willing to, buy food that's actually creating access for other people, right? And in a more local, regional way, where our food systems are more mindful of really supporting our community and not just supporting big factory farms and big food somewhere that's sort of an abstract idea, right? I think that's a healthier way to eat. It's a more transparent way to eat. And it's a way that we can take care of each other. So I hope Hope-A-Min gets to play some role in that, in really galvanizing people to understand that eating is a political act. We make a choice, and where we spend our food dollar makes a difference for someone else, not just for us.
Good for you. And yeah, there's so many aspects to food and eating and all. And I'm hopeful that we can, I will, be talking to the Chiropractic Society for sure, to see if there's ways that perhaps we can get involved with your project and, have some cross, whatever it's called, cross, communication and interaction and support, because again, you're about healthcare and nutrition, and we're about healthcare and nutrition also. What's the best way for people to reach out to you, and donations also get involved?
So anyone who wants to reach out to us, go to our website, which is Hope and Maine. The and is an ampersand, but our website is easy to remember. It's makefoodyourbusiness.org. So that's our tagline, make food your business. And anyone who's interested, we have a huge social media presence on Instagram, Facebook, all of those platforms. You'll always find Hope in Maine there. And we would love to see folks here at our Wednesday market. It starts this week, actually, from 4 to 7 o'clock at night. You can come, and if you want to volunteer at the market, we'll be doing meal distribution. We have our vendors. We do education here for families in healthy food growing and preparation. So there's lots of ways to get involved, and we hope people will come and be a part of this, food community, because even just by participating, you're making a difference.
See, thank you very much for that. And you've educated me on a number of areas. And when the idea of having you was first introduced, I thought, so it's a market, a food market. But there's so much more to it. And so I very much appreciate your time and educating myself and our listeners. And so thank you again, Lisa Raiola. This is Dr. Michael Gottfried with the Chiropractic Society of Rhode Island podcast, Get a Spine.